Hey everyone, and welcome to Pharma Diag-Thearpy. I'm Dr. NK. So if you're a medical student, a pharmacy student, and you're trying to really wrap your head around clinical pharmacology, you are in the perfect spot. We're going to make all of this stuff finally click. Let's jump right in. Does this feel a little familiar? Yeah, clinical pharmacology is just this massive, sprawling field, and it is so easy to feel completely lost in all the details. If you're feeling that overwhelm, trust me, you are not the only one. And that feeling? That's exactly why this channel exists. My mission, really, is to untangle all of that complexity for you. We're going to break down even the toughest concepts into clear, focused explainers so you can start to build some real, genuine confidence in this subject. So how are we going to do that? What's the method here? Well, let me quickly introduce myself and the whole approach we're going to take to connect all the dots. Starting from understanding a diagnosis all the way to choosing the absolute best therapy. Like I said, I'm Dr. NK, and I'm going to be your guide through all of this. I've spent my entire career in this field, and I'm absolutely passionate about it. But you know what? More than that, I'm really passionate about making it click for students just like you. Taking it out of the textbook and making it feel real and practical. My background is a PharmD, which stands for Doctor of Pharmacy. Now, the main thing you need to know about a PharmD is that it's a clinical doctorate. It is 100% focused on patient care. And what that means for you is that my perspective is always grounded in how this science is actually used to help real people. That's the practical focus I promise to bring to every single topic we cover here. Our whole approach is really pretty simple. First, everything you see here is built on solid, evidence-based content. No fluff. Second, my job is to simplify it, to break things down so they're actually easy to get. And most important of all, we will always connect it back to that full journey, from figuring out the diagnosis to picking the right therapy. Okay, so with that foundation all set, where do we even begin? We are starting with an absolute cornerstone of medicine, a real heavy hitter, hypertension. Why start with hypertension? Because it is a condition you are going to see constantly, no matter where you end up. Understanding it inside and out is non-negotiable. So, our very first series is going to give you that complete 360-degree view, covering all the angles you'll need to know as a future practitioner. And we're going to follow a really clear path. First up, we'll break down all the different types of hypertension. Then, from there, we'll dive deep into the drug classes, how they work, their mechanisms, and finally, we'll tie it all together, looking at how you actually build effective therapeutic strategies for your patients. It's a logical path from the theory straight into practice. And this right here, this is probably the most important takeaway of all. This is not about just memorizing a bunch of random facts for an exam. It's about deeply understanding the why, that critical connection between the diagnosis and the therapy. That's what real clinical competence is built on, and that's our guiding philosophy for everything we do. So are you ready to get started? If you want to build a stronger, clearer understanding of pharmacology, from diagnosis all the way to therapy, then go ahead and subscribe and join our community. Our first explainer on hypertension is coming up really soon. I'm excited and I can't wait to see you there.